like to invite up Elizabeth Saw, who will be presenting on long-term outcomes of the WavelinQ device.
Okay, hi. So my name is Elizabeth, and I'm a third-year medical student at St. Louis University School of Medicine. And so today, on behalf of my team, I'm going to just be sharing our research. Our project was WavelinQ and AVF one-year patency, a follow-up prospective study. We do not have any financial disclosures. So kind of just give a background. So according to the U.S. Renal Data System 2023 Annual Data Report, over 800,000 people in the U.S. are living with end-stage renal disease. And of these people, 32% are able to get a kidney transplant, but majority are on dialysis. And so surgical AV fistulas have long been the standard method for creating vascular access due to their long-term patency and lower risk of infection compared to alternative methods such as a central venous catheter. However, surgical AV fistulas are associated with several complications such as Steele syndrome, high failure rates due to maturation failure, wound infections, etc. So the development of percutaneous endovascular AV fistulas using systems such as WavelinQ or Ellipsis devices, they do represent a promising advancement in this field, aiming to hopefully improve outcomes while also reducing the risk associated with the surgical approach. And so, though, just kind of today we're going to be talking about the WavelinQ. And so what it is, it's a fistula device that uses a percutaneous approach, and it's used to establish dialysis access. And so with this device, venous and arterial catheters are aligned with a magnetic backstop, and then a radio frequency energy creates a standard size channel, creating a fistula in the deep system that connects to the superficial system at the elbow, allowing maturation in either cephalic, basilic, or both veins. And so according to the pivotal WavelinQ studies, the primary patency at 6 months was found to be 72.4%, and a secondary patency at 6 months was found to be 77.3%. So pretty promising results looking at the development of dialysis access in patients. And then in 2020, our group reported an early real-world outcomes of WavelinQ placement done between October 2018 and July 2019. And we actually presented here at VEST, so it's good to be back and continuing on with that. And so in this study, 35 patients had a WavelinQ AV fistula placed, with 32 of them having at least one follow-up and an average follow-up length of 2.5 months. So the overall patency rate was 88%, although 47 of the patients did require further intervention. And 11 of those 23 patients were successfully able to use WavelinQ during the study time period. And so while this project showed us that some early promise with this technique, as the WavelinQ AV system had a high initial procedure success, patients did require subsequent endovascular procedures to aid in the maturation, and there was limited data, so we wanted to expand on that further. And so then kind of looking more at literature, subsequently systematic meta-analysis has reported on percutaneous endovascular AV fistulas, including WavelinQ and Ellipsis. And so looking specifically at WavelinQ, as seen in these studies highlighted in red, there was a mean follow-up of 10.2 months. And these studies showed the primary patency was 54%, and a secondary patency was 87%. So that kind of builds to where we are today. And so today we sought to expand that timeline and complete both a 6-month and a 1-year follow-up results on the WavelinQ device in our original patients described from several years ago. And our hopes were to add to the growing body of data on long-term follow-up of those endovascular fistula outcomes. So following this new analysis, the average follow-up extended from 2.5 months back in our 2020 study to now 29.8 months. And of that group of patients, 70% still remain on dialysis, while the remaining 30% were either able to receive a transplant or lost to follow-up. But the remaining demographics remained unchanged. And so at 6 months, the primary patency was 53.3%, and the secondary patency was 83.3%. Then, at 1 year, the primary patency dropped significantly. So it was 53.3% before, and now it is 30.3%. While the secondary patency dropped from 83.3% to 73.3%. It's of note to mention that for this study, we looked at patency out to 1 year, given that a significant number of patients were lost to follow-up after a year, as you can see in this graph. And so this would make longer-term patency calculations not as accurate, so we decided to cap it at that 1-year mark. And we have this right here. As you can see, at the 3-year mark, the primary patency was 7.6%, and the secondary patency was 45.5%. And so this real-world data of 1-year follow-up of the WavelinQ reveals a low primary patency with a reasonable secondary patency, suggesting a significant number of these patients needed endovascular salvage to maintain long-term use of their devices, especially as seen at the 3-year mark. And so then we also looked at the secondary outcomes in these patients, and there was low rates of Steele syndrome and infection, which is expected with an endovascular approach. Intraoperative complications were presented in our early study in 2020. However, we do have the rates of vein site and arterial hematomas, as well as anastomotic extravasation listed here. Of note, 75% of the patient's WavelinQ fistula devices did ultimately mature. However, only 12 of 21 patients on dialysis, or 57.1%, were using the WavelinQ at the most recent follow-up. Finally, the average most recent flow volume was 579 milliliters per second in the cephalic vein and 337 milliliters per second in the basilic vein, confirming previous data that these devices have lower flow volumes than most standard surgical fistulas. And we don't have information about which vein was being used for dialysis. And so with the study, there were some limitations. Firstly, that the small sample size, as we were limited to patients at a single center. And further, since a lot of this data came from patient charts, there may have been some incomplete or missing or poor documentation on the data that could have impacted the results. And additionally, as I mentioned earlier, long-term follow-up was not able to be obtained on a significant number of patients. In conclusion, our results show that WavelinQ and AVF's access had comparable primary and secondary patency with other minimally invasive devices on the market. However, it is not perfect, as its primary patency at 1 year was low with reasonable secondary patency rates. Ultimately, further studies comparing long-term outcomes of percutaneous fistulas with surgical fistulas are still necessary in order to determine the suitability of these in continued use of the technology in dialysis patients. And I just want to take time to thank, St. Louis University School of Medicine, as well as St. Louis University Department of Endovascular and Vascular Surgery for allowing me to be here today, as well as my mentors, Dr. Matthew Smeds and Dr. David Eberts, for helping me out with this study. And with that, I'd be happy to take any questions.
Hi, Lizzie George from Stanford. Really nicely presented. I love the enthusiasm. One of the things that we found previously looking at the cost effectiveness of these endo-AVF devices is the high rate of reinterventions. Mm-hmm. What has your group, and this may be something for your mentors in the room as well, what has your group learned about trying to kind of reduce the high rate of reinterventions and the need for that, given that it is one of the things that doesn't make the technology cost effective?
Yeah, I see Dr. Smeds making his way up here right now. So
yeah, I can answer that question. Full disclosure, I stopped doing these devices about a month after the last VEST meeting that we presented it at, because there was such a high rate of reinterventions. I don't have any information on how to minimize that, but it is a lot of subsequent procedures, both surgical and endovascular.
And on that note, what other questions you got?
Well, I guess what patient factors would you consider to do this procedure? But since you don't do them anymore, and also, it sounds like you had a functional patency of 50%-ish. What was going on with the fistulas that weren't being used?
Your answer?
When you get them working, they do work. I will say that. And they are kind of lower flow volume, so I think dialysis centers have issues accessing them. So obviously people with smaller arms probably would be better candidates. I've had a lot of disasters from these, and so I just don't do them. And so I wouldn't really give you any recommendations on people to do it for, honestly.
Questions from the other
Hopefully
microphone.
no WavelinQ reps are here.
I'll kind of go on some of this. Dr. Smith was one of my mentors as well, and I actually placed a number of these with him. Of those 57% that are usable and cannulatable now, do you know how many of those required subsequent reinnervation actually become usable, or are those all based on primary patency?
Yeah, I don't think any of those are primary patency. That's all secondary
think so.
patency.
Hey, it's Todd Berland, New York. My questions are now just going to become comments, essentially. I was the first vascular surgeon to do these in man down in Paraguay, and in order for the company that was initially bought by BD to do these, they'd send an ultrasonographer down there, scan hundreds of patients, and find the best patients with the biggest ulnar veins, the biggest ulnar arteries. So these patients were screened to be the best possible candidates. We did very successful there, and the initial pivotal trials showed very good data. Then transfer that to the U.S., real world. Our ultrasonographers spent a lot of time mapping out radial veins, radial arteries, diameters of radial arteries at the access point, at the creation point. A regular duplex, when you're vein mapping somebody for a dialysis access, is a very quick procedure for your ultrasound techs. When you're screening 100 patients in your office, it really bogs them down to scan for an endo AVF. So we've gotten away from it altogether at this point. Yeah.
Congratulations.
Yes. Thank you so much for that.